Hello, everyone. My name is Julie Rocha, and today we are meeting with Dawn, and I'd like to introduce you all to Dawn. Dawn, can you give a brief introduction?
Yeah, my name is Dawn Waterhouse, and I'm a physical therapist. I work for Terrio Therapy. I am the clinical manager at the Neuro Rehab Clinic, and I've been a physical therapist for 30 years. And I work mainly with patients who've had neurological conditions, but also spinal cord amputee. And so I use a lot of medical equipment and a lot of new technologies into my profession, including things like braces, like an AFO. I can use adaptive equipment and things like that.
Awesome. Thank you very much, Dawn, and thank you very much for your time and for joining us today. And I'm just going to ask a few questions in regards to assistive technology and what your thoughts are about the current state of assistive technology and your understanding and usage in your work. For example, the AFO.
Okay. Well, like I said, I've been a therapist for 30 years. So in the last 30 years, there's been a lot of changes and improvements on the choices. An AFO is an ankle foot orthotic. It is a brace that helps support the ankle and foot to prevent it from dropping with conditions such as a stroke or hemiplegia that would then make it difficult for people to walk. And so the old styles were just a fixed position, and you didn't have a whole lot of choices as a therapist when you made recommendations for orthotics. Nowadays, there are so much more things to choose from. The science behind it has really improved on the quality of the gait pattern people could then have with these devices. The type of materials have changed. Now we use a lot of carbon fiber, not just plastic.
Right.
So there's a lot of upgrades and changes that have occurred over the years after research and technology has improved on the choices here.
Right.
I also work with a lot of different types of technology when it comes to patients who've had paraplegia or quadriplegia, and the type of wheelchairs they use and the technology that allows more powered devices and controlled through, they have some that you can control through blinking, some through sipping and puffing. So technology has really helped advance the field of physical therapy to help patients in their mobility.
I agree. Awesome. And Dawn, would you say that do you feel that professionals have adequate amount of training in this area as far as the advances in assistive technology? And, before you answer that, I just want to give you a friendly reminder that we are recording this Zoom session. And do we have your permission to record?
Yes.
Thank
Yes,
you
you do
very
have
much.
my permission.
Thank you, Dawn.
So I think, what we learn in school, depending upon how long you were in school, it's been 30 years for me. The technology of today was not taught back then. So it's really the responsibility of clinicians to seek out information. And it is much more readily available now that we have the internet. I will utilize that in the course of a patient who has a device or something that maybe I haven't had formal training on. And a lot of companies are doing training seminars online through websites that will introduce and explain the use of that technology, as well as some of them will provide actual training for therapists on use with patients. So, for instance, I've had lots of prosthetics with my amputees, and there's so many different to choose from. But there's also training seminars that explain how I should teach a patient how to walk with a certain device.
Okay, awesome. And do you feel there's a particular event, workshop, or particular training that you find most useful or that
Well,
you would like to attend?
Yeah, I like to attend in-person training, and COVID has already put a little damper on that, but it also allowed for a lot more accessibility to webinars. So there are a lot more things that I have access to. There's companies that do uh, not a continuing education that's not limited to just one or two sessions. So I have a yearly subscription and I have, boundless information. I don't have enough hours to fill my day to do this training. So there's a good opportunity there. I know that there are, depending upon your field of interest. Again, I'm in the neurological division, and so there I try and pick courses specific to that. But there are so many courses out there, depending upon what you want to do. But we have better access now to information because of the internet and of these webinars.
Right, I agree. As a matter of fact, I just got off of a webinar from the Brain Injury Association in regards to spasticity. And it was a brief, about 30, 45 minute session. And it was just a briefing on the different interventions, whether it be like oral medication, surgery. So that was a well invested 30 to 45 minutes of my time today.
Good, good.
Thank you, Dawn. So, is there a particular conference that you like to attend?
Um, in the past they have the PT conferences once a year, a large conference, but that's usually out of state. It's several days, and so it's not always conducive for maintaining the clinic. So for me personally, I don't attend those conferences as much. So again, I've been doing more of the webinars, weekend seminars. I use a company called Summit Education. They're one company that provides a continuing education, but there's multiple companies out there that provide multiple different types of seminars that you can go to live in person, live on a webinar, or even recorded. And then as a clinician, I'm responsible for taking so many continuing education hours every 2 years for my licensing. So I try and stay on top of all my continuing education hours.
Awesome. And it's definitely a gratifying field. And with that, Dawn, I do have a question in regards to since you said you're on the neurological side of physical therapy, do you find yourself collaborating with other members of a patient's treatment team? For example, um, maybe physical medicine and rehab doctor? Do you collaborate with the occupational therapist? Is there ever a moment where you all put it together before making a recommendation for a patient?
Well, yes, but that it really depends on the setting you're in. I'm in an outpatient setting, so by the time most of my patients get to me, they've been through the hospital setting. They may have been through an inpatient rehab stay. They may have been through home health services. So in those settings, those initial acute settings, it's very important that all the clinicians are talking together with the physicians, making plans for discharge and their continued care. Because I'm an outpatient, I'm kind of at the end of the line of the rehab uh, spectrum. We do have an occupational therapist who I will discuss a patient with, and we will divide up and conquer the needs of that patient. I am always communicating back to the physician in writing, the one who's made the referrals, but we don't really have a meeting time or something that we in our outpatient clinic that has regular contact with a patient's doctor. So we kind of follow up with the patient and the family with what the doctor's orders are. Of course, we can communicate if we need to through written, and sometimes we've made phone calls. But in my personal setting, I have an OT and PT, so we make our recommendations. If I had a speech therapist on staff, that would be fabulous. But it's really hard in certain communities to get the different specialists. So sometimes they're out of town or not easily accessible. But we're always open to communicate so that it is more of a team effect. But the patient and family is the biggest communicator of plan for that patient.
Got it. Okay, thank you. Okay, I've got two more questions for you,
Mhm.
Dawn. So my next question is in regards to barriers to obtaining a particular product, for example, durable medical equipment or recommendation. What would you say would be the biggest barrier to a patient obtaining a piece of equipment or
Well,
tool?
usually the biggest barrier we find in the medical field for this area would be the costs and the financial burden of things. So, depending upon a patient's insurance plan will depend on what things may or may not be covered.
Right.
So some technology is would make life absolutely wonderful for a patient, but isn't always considered medically necessary. And therefore, insurance companies don't necessarily pay for the extra things, they pay for the necessary things. And so, if there is a piece of technology that would help a patient, but is it medically necessary, then they would have to pay out of pocket. And not everybody's in that position. So that becomes a big barrier. And then depending upon your location, we live in a community that we actually have some limitations with at least different resources like speech therapy and things like that. We don't have full access to every technology and every specialty out there. So if you're in a real rural area and you don't have access to getting that in your home or being able to go there, that can be a barrier as well.
Yes, yes, excellent points. Thank you very much. And our final question here is, do you have any words of wisdom for our audience, which are future assistive technology professionals? Any words of wisdom in the field, whether it be, PT, neurological, assistive technology?
Well, I think getting the information out. There's new technologies being developed because I'm a full time clinician. Um, I spend the majority of my day with patients. And so when people come in and visit or have mailings, and at least send out their technology as as a an advertisement of some kind to let us know what they are. The other thing is being taking that technology to some of these companies that provide webinars. I just did a course over the weekend on DME equipment, so durable medical equipment. And I learned about some new technology out there that I wouldn't have known had I not taken that course, because I hadn't heard about it in the clinical setting. So being able to advertise or at least get that information out in a platform that communicates and educates clinicians may allow us to have quicker and better knowledge and access to that information.
Excellent points. Some very good information here, Dawn. Thank
Good.
you so much. We truly appreciate your time. And thank you again for taking the time to meet with me on such short notice. Okay, Dawn. Well, I'll let you go and enjoy the remainder of your day. Talk to you soon.
Thank you. All
Thank
right. Bye
you.
bye.
Bye bye. Take care.